AM 1430, KRGI 105.5 FM. Good morning. I'm Brian Gallagher with guests from Central District Health Department. Jessica Hammers has come back. Welcome back.
Thank you.
And you brought a new associate today. Shirien Hamed is here to visit with us. Good morning and welcome.
Good morning, and thanks for having me.
Let's talk a little bit about why you're here. We're going to talk about community health and collective impact work. And Jessica, I'm going to let you get in, and then we'll visit with Shireen a little bit.
Sure. So our work in public health that Shireen and I are working in, and working in collective impact, meaning kind of getting to the basis of some of those needs that basically are fueling other things. Getting back to the basics of, maybe we're not going to the doctor's office because of more than one thing, and figuring out what that is. It might come down to I don't have insurance. It might come down to I'm not employed. Just kind of all those background info. Maybe I don't have childcare, so I can't get to work, so I can't have insurance, and just like working in reverse and helping people from the ground up.
So that's a good way to get that path started. So Shireen, I'm going to ask you a little bit. Community health workers, I understand you're not alone. You have several associates you work with.
Yes, there is 10 of us at Central District Health Department. We speak mostly different language. We have Arabic speaker, we have Somali speaker, we have Spanish speaker. So pretty much everyone walks into our door, it will be served. Anyone needs help with anything, pretty much. If we didn't help them in the house, we usually refer them to the best interest.
So you do have someone that maybe specializes in certain things, correct?
We do. It's not specialized, but we do speak all language, which is we serve mostly people with barriers, language barriers, let's say, or new arrival to the country or to our community. So everyone needs assistance in any different kind of assistance. Maybe just I need to find a doctor, I need to find health insurance, I need to rent a place, but I don't speak the language. So we got you.
I have a feeling that if you can conquer that language barrier, though all of a sudden it just becomes so much easier. You can see people let their walls down and just say, oh, good, someone who can understand me.
Absolutely. And we do relieve a lot of pressure out of the shoulders, because if you don't speak the language, you can get to nowhere. You will find no work, no place to stay. You will end up with a lot of problems. But if we break these barriers, the language barriers, it's much better, because we get to introduce you to the community, the service that you need, how to find a job, how to find a doctor, how to register your kids to the school. I help a lot of Sudanese people who comes from different environment, different culture, different religion, so they're getting a lot of education. I get to help them register their kids to the school, because registration is different from Sudan, let's say, for example. No vaccination requirement back there, no physical requirements, so it's a lot of stress for the parents to register their kids. But getting someone who's speaking their language, knowing the process, it makes it so much easier for them.
That makes sense. And you talked earlier, too, about some of the questions that might come up about financial assistance. Say there's, some job challenges or, just low funding. You've got some scholarships available, especially for families that are facing hardships like that.
Yeah, definitely. If there are children in the home, for sure, please, if you're seeing any financial issues coming up, we want to be able to kind of walk with you and have one of our community health workers kind of identify those various agencies in the community and surrounding areas that can help you. And we also have our in-house, we have some programs that are doing scholarship programs for childcare specifically. And then, as we all know, Grand Island has, it's a kind of a national thing, but Grand Island, we're also facing a lack of quality childcare too. So there are a couple programs coming up soon that if anybody's interested in possibly opening an in-home or childcare center, to reach out to us, because there are some dollars coming through the city that will be able to help get those quality centers either expand their capacity or new ones open, whatever we can do to get more kids cared for, so those parents can get quality jobs.
there's an opportunity, and they are there to try to help you at Central District Health Department. Just give a call if they have questions.
Yeah, so it's 308-385-5175.
Okay, it can be that easy. Jessica Hammers and Shirien Hamed from Central District Health Department. Come back and see us again, okay?
Thank you.
Absolutely. Thank you.
Good morning from AM 1430 KRGI 105.5 FM.